Morning, everybody. And we start the first session. This is a very innovative and different kind of a session. And we are looking forward to a great amount of interaction and information, which is going to be useful for everybody. So with these few words, I'd like Dr. Sabyasachi to take over the session. Please, sir. Dr. Sabyasachi, please. We have the
So, good morning all of you. We are going to start a very interesting session of practice dilemmas. So, this has been planned by AIOS to guide young ophthalmologists. So, we have 9 speakers in this session.
So, we have the first speaker, sir, in Dr. Anurag Mishra, but as Anurag Mishra is busy with some other talk in a different hall, for him will be representing his talk on the topic, but the talk will be purely given by Dr. Ashok Nanda. The views will be of, I think, Dr. Ashok Nanda itself, right? So please,
career options for a young ophthalmologist.
Good morning, everybody. As a young ophthalmology, we have a lot of dilemmas regarding our future. So this program has been designed to clear some of our doubts, to choose what career, what line is appropriate for us. And we will have various speakers talking on each of them. I'll be highlighting briefly about what options we have. Even though postgraduate ophthalmic education in India has taken considerable strides and improved tremendously over the last decade, still the clinical and surgical exposure is not always adequate to step into a competitive world with medico-legal complications on the rise. So with this background, let's see what are the opportunities we, when we pass out, have. So we have opportunities to start our job, or for going into higher studies or trainings, or to go into research. So opportunities in job can be in the government level to work in a peripheral health center where you do not require too much of skill. So you need a primary eye care facility where you have to start your healthcare work. Or else you can decide to do a job in the medical college, or as a consultant in a private practice, group practice, or institutional practice, or join a corporate hospital, or a charitable or NGO hospital. So other than jobs, you can also think of training if you feel that your training in the post-graduation period is not adequate. So you can go for senior residency training, comprehensive fellowship trainings, subspecialty fellowship training, short-term fellowship, and hands-on courses to improve your skills. Career prospects in foreign countries can be fellowship in ICO fellowship, International Council of Ophthalmology, Asia Pacific Academy of Ophthalmology fellowship, and long-term research fellowships. Educational opportunities can be to appear for ICO examination, Fellow of Royal College of Surgeons, Glasgow, Member of Royal College of Ophthalmologists, Fellow of Royal College of Ophthalmologists, Fellow of All India Collegium of FICO. That's an Indian organization. So each of these points which I said would be highlighted by some of the speakers that you have who have their own interest in the topics they will be speaking and telling you why they chose that and how would you go into pursuing that career. Thank you.
Next speaker. We'll have discussion at the end.
Sir, we can have discussion one by one also because the topics are very different.
Yeah.
Okay. So at the end, it will get a kind of mix-up kind of a situation. Anybody wants to ask anything or add anything? Sneha, what do you have to say? I mean, you are one of the young people who have just, as a panelist, you have just passed out, done your residency, then you have been in a private corporate kind of a setup. Even now you are in an NGO probably working. So what kind of a suggestion you have? Can we have the mic, or you can take the mic there? You can take that mic also.
No, you can speak.
Yeah.
So, what I strongly feel, sir, is that each one needs to find their own way. Initially, you can divide your career into phases. There is a certain phase just after you pass your fellowship where you need a lot of hands-on and a lot of surgical cutting, as we say. So, a few years in an NGO-based or a trust-based institute is very, very good. Now, where you go from there depends a lot on what is the kind of career that you want for yourself. There are some people who are very satisfied with a salaried job and getting patients without having to work so much on the seasons or picking up patients, and there are some people who would want to become entrepreneurs. So after a few years, I think everyone needs to find out what kind of a person you are and what kind of a career you want for yourself, and that is where you need to find pave out the way for you.
Thank you.
Yeah. Can I ask one question? On my right, we have the very successful and a busy private practitioner, extreme right, Dr. Ashok Nanda from Bhubaneswar, Odisha. From Odisha, we have in the government set up as a director, Dr. Sabyasachi, and again a professor in a medical college, Dr. Pranav, again a private practitioner on the left, very successful from Bihar. So words from you, from the private.
What I suggest is, because we have people to speak on these topics that we are discussing, let's discuss each of those points after we hear from the, as she said, that choosing a career as a private practitioner is a challenging opportunity to people who want to face the challenge. And we have Dr. Rakhi, who after doing residency from LVPI Bhubaneswar has taken up this challenge of going into private practice. So let's hear her perspective first. Why did she choose, and what opportunities or difficulties she is facing, and then we'll discuss on that.
Okay, right. Absolutely perfect, sir.
Good morning, everyone. So first of all, I would like to thank the organizers for giving me this opportunity to present in this platform. So my topic has familiar situations where each one of us will face during the initial part of our career. So I'll be presenting on a leap into private practice soon after your fellowship bar residency. So as discussed by the earlier speaker, there are so many options we have soon after our residency. But I would say it's always better to pursue a fellowship if you have time and you have support from your family, because this will fill the knowledge gaps of residency, and this will boost your confidence, especially your clinical as well as your surgical skills. But before choosing a subspecialty, you should have genuine interest in the subspecialty you are choosing. And also look for the demand and scope of that subspecialty in your hometown, whether it is professionally saturated in your hometown or not. Mind you, it is time consuming. But by the time most of us reach the fellowship, we'll be around 28 to 30s. Then there'll be pressure on you from your in-laws, from your husband, relatives, saying, "Arey, it's time to get married. Bacha nahi hua." And all those things, also saas bahu natak will go on. On the other hand, we have the financial burden also if you don't have a supportive family. Finally, many of us will have to give up. And we give up on further training and then go on into job, looking for job. So when you're planning to take a direct leap into the private practice, there are two options. One is joining an already established private institute, and second is setting up your own private practice. So before deciding in between these two options, I would say, first ask yourself, what do you want to see yourself in 10 years? Whether you want a completely peaceful life or you can handle some stress also. How strong is your heart? How brave is your mind? And how healthy is your body? Because there'll be situations in private practice where you have to manage all your complications by yourself, where you have to handle irritant patients and bystanders, where you'll have to suffer huge financial losses initially. So, if you want a little bit of peaceful life, I would say join a private institute. But anyways, again, when you are looking for a job, like in my case, when I start looking for a job, soon after my residency, they said, "You're just ex-resident, how can we hire you? You don't have a fellowship, no jobs for you." Most of the places said so. But I think, on the other hand, few of my friends who have done their fellowship, just after their fellowship, when they started looking for job also, they said, "अरे तू तो fresher है, कितने साल के experience है, नहीं हम लोग नहीं ले सकते." So anyways, फिर भी dramas तो चलेगा ही. But Finally, if you're successful enough to get into private practice in an institute, I would say there are certain advantages. Like this one is already established in the town, so you can get to see and learn how a successful practice works. There is adequate volume of patients, so number of cases and further training is assured. You don't have to give any investments, but you have a fixed monthly income. And if you're supporting seniors, like your professional growth is assured. You can collaborate with other subspecialties also for surgeries as well as for research purpose also. And as cataract surgeons, as we all know, we need a VR support to have a peaceful life. So this is also ensured in an institute. Disadvantage is that you are just an employee. You have a boss. You have your own targets. Your timings are inflexible. You are just one among the many consultants. Not all patients are coming for you. You need to put that extra effort for peer recognition as well as for making up your own identity. Next step is a solo private practice. So, advantage is that you can be your own boss, bindas, absolute freedom to how to practice. You can schedule your own timing, no ceiling to your earning once you become successful. Mind you, this is a very challenging situation. It takes time, extra effort, but yet it is rewarding in the final. Disadvantage is that you need proper planning, you need financial support from your family, you need to take huge bank loans. You can just be a comprehensive ophthalmologist in the initial period. You can just say that I have done subspecialty, like fellowship in this subspecialty, I can practice only that. You cannot say that, you have to be comprehensive. There are stress and tensions of failures, and it takes time. Next is where to start. I would say smaller towns are the best potential markets because they are less likely to get saturated and they give good returns and less time to become popular also. But wherever be the location, it should be an easily approachable location with ample space for your OT, your working, your waiting area, parking, and there should be space for further expansion also. And before choosing, you have to think of your family also. Your spouse job, your children's education, their willingness to relocate, all these things matters. And before starting, I would say you need an initial referral base. For that, you have to go and visit the local practitioners in that area, all the local physicians, and also you need to go and attend the local body meetings to explore the market. Start at a smaller scale, but scale up fast. And while buying instruments and other things, do not compromise on the surgical results and safety at any cost. Recruit wisely. You need 1 to 2 trained staff and few multitaskers also. And initially, you will have to take your time to train as well as to supervise everything. Get to know your patient. Take your time to get to know your patient. Your 1 minute more of inquiring about their personal life or mental health creates that magic of patient-doctor bond. And mouth publicity works like wonders in rural areas. Social media is yet another powerful tool. So you have to build your online presence for you as well as for your institute in your social media, because in this era is runs by social media advertisement only. So to conclude, you need to create your own timeline. Where you want to do your residency, where you want to do your fellowship. And once you kickstart into the fellowship or residency, work hard with effective good management. You have to get the maximum out of your residency and fellowship. And then set your life, your professional as well as family goals. Create your own timeline based on your interests, kickstart. Be a hard worker among all the other peers and be compassionate. You should have a very good attitude towards the patient. This will make you stand out. Keep upgrading and updating yourself. Be humble and eager to learn. Then you'll be successful.
Thank you, Rakhi. Rakhi has covered the topic well, in spite of the fact that she has joined an organization called Alia Eye Hospital Trivandrum, but she has covered topics like why should somebody join into a private practice after initial training. Of course, here you do not mean that immediately after your post-graduation program. It is basically depending on your need. If you want a fellowship program, complete it and go into a practice. There are a lot of plus points that, as he said, that you should have a good training. You should have a area of your practice properly thought of. You know, you cannot just jump into practice anywhere with a lot of competition. Second, you must have a financial backup. You must plan your timings, that how you are going to achieve your goal. The advantages is that you have a satisfaction that you are doing your own thing at your own will, and you are the boss. And of course, finance, I being a practitioner, I know that I do earn much more than what I would have ever thought in a job somewhere or in an institutional practice or a NGO practice. So obviously, finance is not a problem if you cross over the initial 5 to 6 years. So thank you, Rakhi.
So, yeah, so next is we have a talk by Dr. Nilesh Kumar. No, sir. This, talk is by Nilesh Kumar, and the topic is charting way through financial dilemmas, a young ophthalmologist's perspective, and a brief about Dr. Nilesh that I'll just go through that. 1 second.
Dr. Nilesh has done his MBBS from Kasturba Medical College, Manipal, and DOMS from JN Medical College, Belgaum. DNB resident at Lotus Eye Hospital Institute, Coimbatore. He is a comprehensive ophthalmic surgeon currently undergoing retina fellowship at Drishtipunj Eye Hospital, Patna. And he is also setting up his own private practice.
Thank you so much, sir, for this kind of introduction and for this kind of opportunity.
And you are obviously trying to hit the bullseye, because this is the most important point which a young ophthalmologist
Yes, sir.
thinks before jumping into practice.
Yes, sir. As you aptly said, sir, once you cross the initial 5 years or 10 years, then you don't have to think about this. Though many established practitioners and hospitals also do their financial planning, but initially it is very important. So I'll be talking about charting your way through financial dilemma, a young ophthalmologist perspective. So these are my financial disclosures, none clashing with our talk. So first of all, what is a financial dilemma? It is a difficulty in a financial decision which one is presented to where they have two equally good or two equally bad options and the correct decision is not immediately apparent. So how to go about it? So this is a question that I was asked when I bought a washing machine during my PG days. I was first year resident and I bought a washing machine in my flat, and my consultant asked, are you so lazy you can't do your own laundry, or you can't go and deliver the laundry to the laundromat? But I don't have any option. It was back of the mind thinking. But then when I had to explain it to him, it was a very interesting explanation. The laundromat 5 kg costs 250 rupees. Every week I have to give a 5 kg load. So every month it is 1,000 rupees. 3 years of residency, 36,000 rupees. The washing machine cost me 6,500 and 2,000 rupees of detergent. So it is 8,500 versus 36,500. So is it not a good financial decision? Except that I don't have to wash my undergarments. I can't give it to laundry, but here I can do it in my washing machine also. So there is an intangible benefit also, and there is a tangible benefit that I got a profit of 24,000 in 3 years. So that's how you have to take your financial decisions. You can't think that this is it is just for a show or you are lazy, but there has to be two components in a financial decision. The tangible, what can be physically measured. It is return on investment, the capital you are expending, the debt you are taking to get that machine, and the upfront and the deferred payment, whatever way you are going to pay for it. But there are also intangible benefits, that there is a necessity. I don't have time to go to laundromat, so I can put it in the washing machine in the night when I come back from my residency and get the laundry done. There is a desire to have something. When you are going to buy a machine, you want to have your setup to have the best machine that is possible. That is the desire. Or that can be a learning. My father is not a retina specialist, but he got a OCT because he wanted to learn. He was not able to go anywhere and learn. So he just got an OCT machine just to learn. So that is also good. You can get that intangible benefit. Or there is the ego that somebody else is having. I want that first in my, that Veritas, Johnson & Johnson launching Veritas. In Bihar, I want that machine to be first in my hospital. So that ego also is a good driving factor if you go in a positive manner. So, but the latent tangible benefits we don't consider are to increase your footfall. Like if you construct a ramp in your hospital where wheelchair patient can come in, we don't consider, because it is, we said that it is ground floor, we can just carry the patient inside. But if your hospital can brand themselves, like it is friendly, disabled friendly. Even if you're getting 10 more patients annually 10, one patient per month, you can get a disabled patient. They feel happy, they go and they increase, they say word of mouth, and you get 10 more patients from each of those patients. Apart from that, they themselves will recover your cost of investment of building a ramp within a year. Then decreasing your waiting time also is a latent tangible benefit. How can you increase your patient flow to decrease the waiting time and to navigate a bottleneck? So like most of the VR practitioner, we have to push back the chair where we examine the retina. So it takes around 30 seconds to keep it back, and then 30 seconds to make it in front. So I invested into a ophthalmic chair unit where it is a click of a button. It just goes into the position I want, and then another click, and it just comes back. It is costing me 2 lakh rupees extra, but it is saving me around 30 minutes per day. So I can perform 2 more phaco surgeries in that time and recover that cost within a month or 2 months. So those are the intangible benefits that we have to consider. So the financial planning for any hospital goes to separate your salary from your earning is the first thing. You separate your salary, and whatever you are earning apart from your salary should go back into the hospital in well-planned manner. First thing is to build up an emergency fund at least for 6 months for your running cost. COVID has taught us that our hospital can shut down anytime, and we have to pay our salaries, we have to pay EMIs. So we have to have an emergency fund. Then we have to maintain and proper input-output registers to know what we are earning and what we are spending. And then we have to plan our future. So how to plan our future? Sorry, I'll just take 2 minutes. To avoid that concept, that is the concept of reverse EMI. So we see if we take a loan of 10 lakh today, if we have to pay after 5 years, we have to pay 12.16 lakh rupees. After, if we are going for 15 years, it is 14.5 lakh. And for 20 years, for 10 lakh, we are paying 20 lakh rupees. The concept of reverse EMI is you start saving. If you want to buy something after 5 years, 10 years, or 15 years, you start saving for that right now. So if you want to buy an OCT machine after 5 years, you start saving the same amount today. So for 5 lakh, if you are going to get a goal is of 10 lakh, then you only have to save around 7.5 lakh for next 5 years. For 10 years, it is just 6 lakhs. And if you go for 10 years, then you are going to see that you are going to invest only 4 lakh. So total amount invested for 20 years is only 4 lakh rupees. A 16,000 rupees, 1,600 rupees SIP right now will give you 10 lakhs later. So if we adjust it for inflation also, we are going to save too much. Even the machine is costing 10 lakh rupees, we adjust for inflation and we plan everything, then we are going to get the machine at least 1/3 of the price that we need to pay. So another effective option is to bundle your consumables. That is only viable for a certain threshold if you have. And bundling with premier items, we should not take because it is a bonded lever. If you go with bundle with toric, bundle with multifocal, then you are bound to sell that, and that is a bonded lever we have to do. So avoid that. And bundle on entire consumable range. If a company is having pharmaceuticals, blades, and all, then you bundle on everything so you can get a good result. So to conclude, discipline in investing is very important. Focus on upskilling yourself so your earning increases, and after a level you don't have to think about all this. Always value the value over growth strategy. Avoid wastage and be cost effective, and never do the cost cutting but be cost effective. Thank you so much.
Thank you, Dr. Nilesh.
Thank you.
But what they say in financial planning, from the day one, you have to have a professional chartered accountant associated with you who will guide you properly. Otherwise, you cannot maintain. There are many records to be maintained also for tax purposes and other purposes. So it is always better to get the advice of a consultant so that you will not be lost at any point of time during your financial planning.
Yes, sir.
Am I correct?
Yes, sir. Yes, sir. We also have a chartered accountant, but we should take the financial decision, and they should not tell us that you take at that time, because they focus more on growth. So our strategy might be different than them.
Their guidance is required.
Yes, sir. The guidance is definitely a must.
Nilesh, one thing I just
Yes,
wanted to know, I mean, just a basic thing. If you are earning around 1 lakh rupees, for example, in a year, right? How much would you spend on improving or improvising or purchasing equipments or upgrading your hospital? What percentage do you think would be a wise?
Yeah, it depends on individual to individual, sir. But whatever I could gather in interacting with everybody is like 50% is the running cost of the hospital. Whatever we are earning, 50% goes into the running cost, and 30% is what we should plan for our immediate goal, like in next 1 year, 2 year, 3 year, and 20% should go to upgrade. Like if you want a better better
So that-
building or anything, so 20%.
So with your share, you don't
sir.
save anything. You don't have anything for yourself. I mean,
No, sir.
for
This
yourself.
is first thing is we take out our salary.
Yeah,
So
that-
50% in the 50% our salary is also included.
Okay, right.
Well, it doesn't happen that way. Normally, I run a hospital, I know. So the running cost of a hospital comes to around 60 to 65% is the minimum. Okay. If you include all the salary and everything, then there are liabilities which will go to another 10%. So roughly you are left with about 30%, which you, out of which you think how much you keep for contingency and how much you spend for the upgradation.
Upgradation,
So
right.
roughly 30% is what you can think as a saving from a hospital, and you plan from that saving how much you would like to keep it for for a emergency use and how much you upgrade.
And this share is very important. If you want to improve upon your practice, upon your establishment, this share has to be done on a regular basis, I suppose. So, thank you,
Thank you,
Dr.
sir.
Nilesh,
Thank you,
for
sir.
enlightening us on the financial aspect. So, next speaker we have Dr. Deol Biswas, I suppose. Yeah. So, can we have the introductions? And just one second.
Yes, Dr. Deval is a senior consultant at Sushrut Eye Foundation and Research Center, Kolkata. She is a cataract and refractive surgeon, and she would be talking on, give the topic, please.
Yeah, I'll just, the topic is why I like to be associated with a NGO hospital. Plenty of surgical exposure and work satisfaction. By Dr. Deol Biswas. Over to Dr. Deol Biswas.
Yeah, she is preparing.
When I got this topic to speak on, I felt so old and wise. However, listening to the speakers before me, now I feel like the poor cousin in the family wedding. All those private practice and lakhs that they were talking about. However, I will try to convince at least one or two of the younger generation that they should join a trust hospital, at least in the first half of their career. Now, instead of talking about how a trust hospital is good for you and all that, I'm going to hold up a model for you. The hospital where I work, this is an NGO hospital or a trust hospital, Sushrut Eye Foundation and Research Center. It is located in Calcutta. And when I joined this place about 12 years ago, it had only one building and one branch at Berhampur. We now have 3 buildings actually, and we have the various branches which have opened up at various places, and more branches are opening up. We also started off when I joined with just 15 doctors. They were all senior consultants. Now we have around 45 doctors, which also includes junior consultants. Of course, besides this, we also have a lot of trainees. So, Sushrut Eye Foundation, along with another hospital of a similar model called Disha in Calcutta, it would be fair to say that we cover almost the entire, 80 to 90% of the population of Calcutta and the surrounding areas who fall in the lower income and mid-income group. So we don't have a lot of celebrities walking into our OPD every day, but yes, we do have a lot of patients. That's because we usually provide free or a much subsidized service to the patient. And we have various organizations which fund us. Obviously, we can't provide subsidized service and give a decent salary to the doctors and staff. So we have a lot of organizations, NGOs funding us, and these are some of the NGOs which are actually funding us and thus diverting their funds, and we do the work, they provide us with the funds. All the work is not necessarily free, but a lot of it is subsidized. What are some of the projects that we are involved in? One is outreach activities where we go outside the hospital, pediatric camps which are done within the hospitals. These are totally free. And how does this help young ophthalmologists joining the hospital? Obviously, if you are interested in doing a pediatric fellowship, or if you've just done a pediatric fellowship, you get a lot of exposure, because from these camps we pick up a lot of pediatric cases for squint surgeries and for other surgeries. Diabetic retinopathy screening camps are regularly held, usually on Sundays in the hospital and also outside at outreach sites. Besides this, awareness campaigning, vision center, vision van, not directly related to ophthalmologist, but these are the channels that bring in the patients. These vision centers that are located in the periphery, in the rural areas, vision vans that visit all over. And the vision van actually started during the COVID time when people could not come to the hospital. And now we find that with continuation of this, our footfall in the hospital has really increased, because these are the services that bring in the patient to the main center in Calcutta. Activity over the last 5 years, I'm just trying to show you the growth pattern that has taken place. Now here, concentrate on the OPD number, not so much the IPD number. The OPD patients that are coming in, the numbers that you've seen, these patients are all patients who are given service at a very, very subsidized rate. And you sort of do a registration and you are provided with all the services. Now, how does that help an ophthalmologist, a young ophthalmologist? Look at the number of patients that you are exposed to. On a regular basis, a young ophthalmologist in our hospital on a bad day sees around 50 patients, and somewhere on a good day sees around 90 patients. And a senior ophthalmologist, on an average day, I see 50 patients, and it goes up sometimes even to 100 a day. And now I'm mostly seeing appointment patients since I've become a senior consultant, and my appointments a day are almost like 70 to 80 patients a day. So you are being exposed to this number of patients and a wide, a varied section. It's when you are sitting in the OPD, before you actually divert the patient to a specialist, you get to see the patient. So even if you're sitting in an OPD and an patient without an appointment comes in, it may be a corneal ulcer. So you are exposed to a corneal ulcer before you total cases that have been supported, these are the total number of cases that we have performed surgeries on. So this is, when I'm talking about surgeries, these are the cases where we have done free surgeries or subsidized surgeries. I'm not talking about the ones who come in paid. These are the cases where we are doing free surgeries. And a trainee today is getting an exposure of 1 to 2 cases depending upon the skill and per day, and a junior consultant gets about 10 cases per day. Of course, that's on rotation basis depending on how many junior consultants we have, and the rest of the cases that are there is done by the senior consultant. The senior consultant also does a lot of free and subsidized cases. When I started off in this hospital, I was doing what we used to call camp surgeries, around 50 to 20 a day. These are some of the training facilities we have in our hospital, and these are the number of people who have been trained in our hospital over the years, last 5 years. Work satisfaction. Now, when I was making this slide, the head of the institution, Dr. R.C. Paul, was sitting by me, and he was doing his own work. And when I told my people, I said, show a bit of the packed OPDs and all, he started laughing. He said, that gives work satisfaction. He thought I was just trying to, because he was nearby, I was putting up this slide. But that is not the case. See, work satisfaction again varies from person to person. It depends on your perspective. At the end of a OPD, you can be very, very tired. That tiredness is of 2 types. You can be very, very tired because you have seen around 80 to 90 patients. Every fiber in your body is hurting. You just want to go back to bed and curl up there in a corner, but believe me, your mind and your soul is so satisfied. You are contented, your body is tired. There is another type of tiredness which once in a while we face in our OPDs on when there are bunds and when there is a bad weather, where you have been sitting in the OPD from 8 to 5 in the evening, no patience, and at the end of the day, you are very, very tired. Your body is tired and your mind is tired. So that is another type of tiredness you have. Again, job satisfaction depends on the sort of lot on your own personality. You have, I always feel there is always a practice personality. The people who are charming, who can sugarcoat their thing, who have a lot of patience to listen for 45 minutes to a person describing how his eyes itch and pain and water. And you have the other type of personality. So that is work satisfaction for you. Thank you so much.
Thank you, Dr. Doyle. Actually, she explained about how the young ophthalmologist should benefit by joining an NGO, having good exposure to various types of cases, also have work satisfaction, treating people free of cost, and of course, at a cost of improving your own skills. The next. We have the next speaker is Dr. Gopal. I would request you to introduce yourself because I do not have your CV. So before you start, you can just introduce briefly and then go ahead with the talk.
Yeah, a very good morning to one and all. Respect to the chair and all my dear friends and colleagues.
And the topic he's going to speak is group practice is the best option in today's competitive era.
Yeah. I'm the past president of Maharashtra Ophthalmological Society, and right now I'm the managing committee member representing MOS and AIOS. Yeah. A lot of you must have heard this story in your childhood. One stick, easy to break. And a bundle of sticks takes time and is difficult to break. This presentation of this slide does not at all depict that solo practitioners are going to be vanished in future. No, not at all, because I am myself a solo practitioner till date and I'm venturing into a group practice. There comes the role of what group practice means to one and all. These fancy gadgets are going to be part of your armamentarium in near future. Believe me, people are going to Google it and they're going to ask you, what are those fancy gadgets? Don't you have those? And on the right side, this refractive suite of procedures. We all know that we earn on cataract surgery and we invest on the refractive procedures. But still, if you do not have this facility available in your hospital, then you might lose that patient to your neighboring hospital. Artificial intelligence already entered. See, just imagine a rural ophthalmologist sending a picture of a diabetic retinopathy and asking for your opinion. And if you don't have time in your busy OPD and OT, then you may be responding to him the next day and he might just shift to another ophthalmologist. I agree with you that private practice gives you more profit in initial days, but that is only in initial days, but the life that you live in group practice is totally different. What happens if some untoward incident happens to you? Let's take an example of you have an accident, a major accident, you are bedridden for about a month or so. You may be having 100 OPD per day, some 100 or 200 cataract surgeries a month, you must be earning 20, 30 lakhs, but what happens in that month? It comes from 100 to zero income. Why you want to have the stress of infrastructure? See, gone are those days when the 10 by 12 chamber was sufficient for an eye specialist. No, it's a fancy infrastructure, good looking, all armamentarium with best of equipments. It is not just investing in equipments. I'm sure many of you all must have bought an OCT 2 to 3 years back and must have upgraded it. So that's, many a times I think whether we are earning for ourselves or for the company, instrument company people. Maintaining the human resources is again something, an EMI, day in and day out, you have to look after it. See, no longer are those normal eye hospitals going to be the standard. Like NABH has entered into ophthalmology, that is supposed to be the gold standard. Maybe in near future you will have the green building and so forth. That is going to be the natural, normal norms without which you cannot practice or you cannot get yourself empaneled with insurance companies or with central government health schemes. Ophthalmologists are going to increase. It's not going to go down. So you're going to have bigger and higher competition. Corporates have already ventured in ophthalmology and they are going to be our biggest competitors. Time management. See, maximum you can work is 16 hours a day, maximum. because 8 hours is what is recommended by the professionals to take sleep. And minimum would be in group practice, you aim at working only in that 8 hours per day. That improves your lifestyle. How many of you have gone for a vacation for a month in your solo practice? Just imagine. Again, the statistics remains the same. You are earning 100 and it becomes to 0 if you are going on a vacation. That's not in group practice. What are the types of group practices? One ophthalmologist, under which there are n number of ophthalmologists. That is one era of group practice. The commonest is 3-4 people coming together and starting a group practice. They share in their financial, administrative, and all skills. And a very common and existing structure is also that one has a LASIK center and everybody goes and operates the LASIK procedures. Yes. Before you even think of going into group practice, leave your ego at home and then think of starting a group practice. Because we being an intelligent, intellectual ophthalmologist, that's the biggest hurdle. And you can group in financial, have good chemistry between your friends. And it's better if you have a friendship together that will help you in developing and branding your own group practice. Definitely it gives you higher income potential because different people, one may be good in administration, one may be good in finance, one may be a good phaco surgeon. And so you just club in all those things and that gives you an additive effect. As I mentioned, work-life balance, you can afford to take a leave without even compromising on your income. You share the economy. Individually, we can do only partly things, but in a group, we can. And of course, the return on investment is definitely faster. But there are tips. You must have a clear-cut black and white business plan before you venture into the group practice. Now, the last 3 words are most important. First 3 words are important. Pick the right person, but remove the wrong ones because that will harm you in the long run. You should have a strong administrator. If you're a group of 3-4 people, one should be the decision maker because otherwise your staff, your subordinate are going to take advantage of you. Because in the meeting, if there are some discussions and 3 directors say 3 different things, maybe they are right, but the person, your staff is going to pick up the person whom he'll be benefited from. So the one should be the decision maker. That's very important. Profit sharing to be transparent. One should aim equal investment, equal profit, equal working time. That is the best model, I feel. You should work together, play together, meet regularly, and that's the most workable group practice model. But there are few things. As I tell, ophthalmologists are intelligent, intellectual people. So getting along 2 intelligent people is a different task. Improper structuring. If one has invested 50%, one has invested 20%, then again the hurdle and the differences start maybe years to come. Exit policy. Something happened wrong to you. What are the exit policies? Again, in day 1, in black and white, things should be written. Lack of business understanding, which most of the ophthalmologists have. You should have a long-term goal. What happens after you? What are your successors going to take over? Office politics is in every institution, personality and ego issues, and learn from your partner's strength and improve on your weaknesses. Good saying by Warren Buffett, if you don't find a way to make money when you sleep, you will work until you die. My dream, my institute which is coming up is ABOI Institute. I want...
Sir, we are ready.
Just 30 seconds.
Yes, sir.
I want...
Sneha, you can come here.
Yeah, ABO Institute should be known and not Dr. Gopal Arora. So successful brands are an experience. They are not an entity. So, friends, just to sum up my presentation in one slide, you should develop a brand. This is a good hospital, good hospitality, good OPD patient, good surgical treatment, not individuals. That is why you can develop the brand. Thank you so much.
Thank you, Dr. Gopal. To summarize, you said that a group practice has less stress and better work-life balance. Financial benefits do come whenever there is a time of crisis. Cost recovery of fancy and modern equipments is better. And of course, you can compete with corporates. That's the advantage of joining a group practice.
Yeah, a peace of mind. Dr. Nilesh, can you keep taking photographs, please? I'll take it from you. Next speaker. We have the next speaker, Dr. Sujata Das. May we have the introduction, please, Dr. Sujata Das.
Dr. Sujata had her MBBS and MD from MKCG Medical College, Berhampur. She had her training from LV Prasad Eye Institute and from Australia. Then she is now heading the cornea department of LV Prasad Eye Institute, Bhubaneswar. Sujata, please.
Good morning. So I'll be talking about the institutional practice, it's how it is safe and peaceful. So I'm not going into detail of private practice. We've heard about private practice, we've heard about group practice. So I'll say what are the advantages. There are everything has its own advantage and disadvantages, and basically it depends on what you want in your life. Already the first speaker I think has described what you want. So in the working environment in an institutional practice, is you work for patient, but you are same time you're a hospital employee, but you don't have additional responsibility like financial, more planning and all. So the number one advantage is sharing responsibility. So there are different people for different jobs. Like a private practitioner, you have to put your head in everything. But here, the different department like receptionist take care of check-in and check-out, surgical counseling are done by surgical counselor, medical tests are done by lab technician, and cleaning and security are taken by support staff. So coming to number two advantage, as a private practitioner, you may earn more, but in institute practice, you have a salary and you have a steady income. Like for example, COVID again has taught us in private practice it may hit badly, but in institute, most of us can sustain for a few months or year. Though there are added benefits and increment. Especially this third advantage is applied in ophthalmology because you have all money, everything is expensive and every year it keeps on changing. So it's a heavy branch. Whenever people do PG, now that is, they calculate whether to go to ophthalmology or not. And a single person is difficult to take the cost of burden. In institute, mostly it is done by the management team. Again, latest technology is not only to acquire a machine, you need to upgrade also every year or every 2-3 years. So in an institute, it can be easily done. So as a teamwork, and this is the biggest advantage compared to other places, I'll say. In solo practice, group practice, there are people who practices even private practice, but the environment in institute is for research and publication. I'll say this is the biggest advantage in institute practice. If you want to career in publication research, the institute is the best. So in one setup, is even if it is cornea, retina, glaucoma, in one place everything can be taken care. So basically you can do a subspecialty practice rather than a comprehensive practice. And continued career growth. In a solo practice, you may earn a lot with experience or with a year passing on, but here is a career growth. You may join as a junior consultant, but at one point of time, even the head of institute. Even people have joined as a DNB and they become the head of the institute in our system. And because you have trainees all the time, DNB fellows, you learn every day because you have classes for them, you learn as well as you train them. So this is the excellent opportunity to be up to date. And funds for emergency situation, like for example, COVID, there are a lot of research funds which private practitioner may not get, but you may get as an institute person. There's a legal issue. The institute takes care of that, not as an individual, you have to take care of all this litigation. And amenities like you meet people and you have cafeteria, even in small group practice it can have. But this is the place where you meet people, you share your ideas, and the research ideas come from this. And you build new relation with the other hospital. Sometimes if it is only ophthalmology hospital, you build relation with medicine or rheumatologist. When you do some patients, you send patient to them, or in any research, you do new relations. Thank you.
Thank you, Dr. Sujata. I'm sure you must have lured a lot of youngsters to join an institutional practice by your talk. Just to summarize what you said, the institutional practice gives you or makes you learn teamwork, good quality patient care, exposure to a lot of latest technology, no significant administrative or financial responsibilities, steady income, satisfaction of training the youngsters, and of course research and publication. Thank you, Sujata.
Dr. Tanay also wants to add something.
Yes,
Dr. Tanay,
yeah. Okay, before I say something, I am in a institutional practice. Actually, it's a medical college. So I had the department there as a professor and HOD. So in a medical college or such big institutes, like we have this clinical, you are a clinician, you are a teacher, you teach the UGs and PGs and also the research. So you have like so many aspects in you, and then you grow. Higher up, you have the administrative responsibilities also. I was there before in a private practice, and I also passed through this NGO thing. But I realized that you need a very balanced life in your life. So these bigger institutes give you that, like you have time for your institute and also for your family. Okay, and then you have the added advantage of teaching and grooming younger people, PGs and UGs, and also you have the satisfaction of research and publication, where your names come up in so many journals and people get to know. So these advantages are there, and you have peace of mind, and you can
thank you,
practice
Doctor.
Thank you, Dr.
Dr.
Tanay.
Natung, I think this is the same topic that...
The next speaker is Dr. Suchita Pareja, and she did a fellowship in pediatric ophthalmology and strabismus from Arvind Eye Hospital, Madurai. Now she is working as the head of the Department of Ophthalmology at All India Institute of Medical Sciences, Bhubaneswar. Over to you, Doctor.
Yeah, good morning, everyone. I'll be speaking on a topic of why to join a medical college, which gives you a best satisfaction. So I have no financial interest in this presentation. So when you are coming out fresh and you are in a big place where there is a changing scenario and ophthalmology is rapidly growing, and with that technology and practice pattern changing, your lifestyle is changing, the patients are quite demanding, so you have a lot of choice. You're in a maze, you have 1, 2, 3 options with you, but always think which is best option for you. So for me, if you are joining a medical college, what I want you to understand is you have to be a teacher. So who is a medical teacher? If you ask some of your students, or you ask yourself, I became an ophthalmologist or I became a urologist because I was taught well by great teachers. Well, you influence the students to choose their career. And if you see, this is a quote by Ernest Leary, who said, a poor surgeon hurts one person at a time, but a poor teacher hurts 132. So good knowledge, you should have a very good knowledge, you should be clinically competent, surgically competent, but along with that, you have to have a good communication, you have to have a stimulating and encouraging environment. That is how you are going to produce good quality doctors or ophthalmologists. So if you look at this role model who is a teacher, he has 12 roles to play. He's just not a facilitator and a mentor. He is not only a curriculum developer, so teaching expertise. Even at a student who is at distance, you can become a mentor. You are a guide, and you have a lot of role to play in their shaping. So if you ask anyone, all clinicians enjoy the role to teach. You ask each of you, yes, I feel like teaching someone other than just me, myself also. So for that, it can be something difficult, it can be easy, but it all depends on your attitude, skills, and knowledge. And you should have the soft qualities also, being very motivational and having a lot of patience. So who is the role of a clinical educator? I'm not going into detail, but you have this which you can develop. Like you can teach your undergraduates, your postgraduates, give them what is, look into them, look at the feedbacks, and actually monitor them of not just giving knowledge, but as an educator. Well, this is a field. If you are in a medical college, you have 2 types. You are joining a state medical college, or you are joining a institute of national importance. Yes, more or less it's the same pattern is there, but how you work out. Research is something you can do. Starting from a case series or writing a case series, you can go into doing a randomized clinical trial, a meta-analysis. You have all types of clinical research trials to go, and in different phases, you can document, analyze, and then publish.
So sometimes what happens, you just do a research or a thesis and leave it there. But you can go ahead and do the publications. You have lot of facilities with you, a very good internet, you have libraries, you have support staffs, you can get lot of research grants and patents if you are good enough in that. And with that, you get recognition. Well, third point is your clinical practice. Well, a lot of you are ophthalmologist anyway, you will be seeing your patient. But what is the advantage in being a medical college? You have a multidisciplinary approach. Today, the patient is coming with a proptosis, and you think that it has come out because you have a neurosurgeons with you to look after doing a DSC scan and everything, and you see that it is a neuroaneurysm and you can treat it. You can get expertise when you do more and more difficult cases and challenges are there in front of you. You are all the time having an emergency, you have a support system, so that actually builds up and your acumen of clinical knowledge. You get to have how to maintain the records, to write SOPs, to do a policy maker. So it's just not patient care, you have a health system, medical informatics, you have how to go into the population, public health. So it's a variety of collaborations and policy making which you can do. But at the end, you will be a professor who will be giving sitting over there and in the policy making system also. So professional development is there. You get a long-term, you get a period of leave where you can go and do your short-term, long-term training. You continue your skill training. You have a lot of collaborations, networking. You can do a lot of seminars, CMEs, conferences, teach your students, learn from them also. Advantages, a work-life balance, it can be done. You can have a time management. You have also productivity. You can make your resume good. You can go and have international collaborations, be a professor or a visiting professor. So you are gaining a lot of things, a less stressful life you are leading. But the disadvantage is you have a fixed salary, hierarchy is always there, infrastructure, some of the places are poor, you don't have the latest development, red tapeism, bureaucracy, political interference, and sometimes you have that comfort zone. So I just want to conclude saying that this hedgehog concept where you are passionate about doing something and you should know what is best for you and what drives the economy. So you have to find out your sweet spot. So to conclude, choose as per your temperament, contribute to the society, because at the end of the rat race, you will become a rat if you don't know what you are contributing to the society. With that, you become a good physician, surgeon, and a teacher, and a good human being. So I'll just conclude my talk with this quote: the only way to do great work is to love what you do. If you haven't found it, keep looking for it. Don't settle. Thank you.
Thank you. Thank you, Dr. Sucheta.
Yeah.
Whatever you said are almost similar to a private or a institutional practice, except that probably in addition you have responsibilities of administration and also policy making involvement. So good. I think that's also a good opportunity for youngsters to decide in joining a medical college. Sir, now you can.
You want to say anything, sir?
Yeah. No. I just want to re-emphasize again, it's a very balanced life. Like only the disadvantage is you have a fixed salary. Of course, that also keeps increasing 3% every year in the Government of India institutes.
But one point I would just like to highlight is that you are working in an institution which is a institution of excellence like All India Institute of Medical Science. That kind of facility is not available in all the medical colleges. What you said about doing a research and getting the kind of support that is required. So that uniformity is lacking. So that is one thing which has to be kept in mind. So next
college, the institution are best.
Yeah.
And depends upon the mindset with what you want to do in your future time.
Next speaker we have Dr. Devesh. He'll be talking on taking international examination. He is a MBBS from AIMS Delhi, MD from AIMS Delhi. He's done senior residency in Vitreoretina and ROP from AIMS Delhi. He's done a DNB, FICO, UVA, FRCS Glasgow, FACO in Retina. He's an ex-assistant professor from AIMS Rishikesh, currently working as an assistant professor in Lady Hardinge Medical College, Delhi.
Good morning, everyone. Thank you, sir, for the introduction. So I'll be speaking on the joys and dilemmas of pursuing international examinations. Normally, I do not display the post-nominal initials. I'm not fond of displaying them, but that is the requirement of this topic, so I have displayed. and I have had the pleasure of completing my FRCS and FICO. So during the life of an Indian medical postgraduate, he or she will come across this thought of pursuing the international examinations. Often we get this information from our seniors during our residency, during the second year or third year, and then we jump into the rat race of giving these examinations without making an informed choice. So it's a forced choice, often from our seniors. So today I'll like to discuss on that, and so that you may in the future make an informed choice. So there are two options for pursuing the international examinations. One can be the examinations to study abroad, which is not the topic today, which we will be discussing, but the other one is to gain some certificates or fellowships, international fellowships. So what are the common examinations that are being given or that are being undertaken by the Indian medical graduates? Our postgraduates are the ICO examination, that is the International Council of Ophthalmology, then the Fellowship of the Royal College of Surgeons, and there are 3 colleges in United Kingdom, the Glasgow, Edinburgh, and Ireland, and then there is a Fellowship examination of the Royal College of Ophthalmologists, London as well. So coming to the International Council of Ophthalmology, it is an international body that aims to improve the ophthalmic education and patient care across the world, and these are the following examinations that ICO offers. And the initial examinations are the standard examinations, and then after clearing the advanced examination, you are eligible to use the acronym FICO, that is the Fellow of International Council of Ophthalmology. So combined, the initial Part A and B examinations focus on the basic sciences, and then you have the clinical ophthalmology examination, which the syllabus of which is similar to the postgraduate examination, so you need not study anything different from the post-graduation. Then you have an advanced examination which you have to clear to get the acronym, and this examination is a little tougher than the clinical ophthalmology examination with a lesser pass percentage. And sometimes you need to clear a face-to-face ophthalmology examination also in certain countries to get this acronym, but in India we do not need to complete the face-to-face ophthalmology examination. It's not mandatory here, and after clearing the advanced examination we are free to use the acronym. Now there are certain subspecialty examinations that have also been started by ICO in the last couple of years, and you need to have 1 year experience in the subspecialty to pursue that examination. Coming to the fellowship examination of the Royal College of Surgeons, the most popular is the FRCS Glasgow, and FRCS Glasgow has also 3 parts. Now the difference here than the ICO is that the part 2 also has some component of general medicine and neurology, and you should know about the acute management of the medical emergencies as well. And you can only appear for the part 1 examination in your second year of your residency onwards, and for the part 2 examination you can only appear after you have 6 years of experience following MBBS, including internship. So once you clear the part 2 examination, you are eligible to become a member surgeon in ophthalmology, and once you clear the part 3, you are eligible to become a fellow. So part 3 is the toughest exam, and it is based on a structured oral viva and a clinical examination of real patients. There are certain exemptions which one can go to the website and see what parts can be exempted if they have covered the ICU exams. Then you have the Fellowship of the Royal College of Ophthalmologists, London, and it also has 3 components, but the unique component is the refraction certificate. So you need to have a experience of performing 50 to 100 refractions. So you have to commit yourself to doing such a refraction, heavy refraction before appearing for this examination, because the pass percentage is as low as 25 to 30%. There are no exemptions for this fellowship. The benefits of appearing for these fellowship exams, international certificates, is that they'll provide you with the standard certificate that will validate that you have a knowledge of a standard ophthalmologist across the world, because the Indian education system is very diverse, and after post-graduation, some may do a senior residency, some may be doing a fellowship or MCH, that too of variable duration from 1 to 3 years, so it's not a level playing ground which is there, and each one of us may have a different education level. Now, other benefits of pursuing such fellowship examinations, especially if you are in a central government institution, if you are appearing for the UPSC examinations, then if you are a FRCS or FRC of fellow, then you get additional marks in the assessment. It's a roadway to the ICU fellowship. If you have cleared the standard and the clinical examinations part of the ICU, you can apply for international fellowships ranging from 3 months to 24 months, and you are provided a grant also in these fellowships up to the order of 5,000 to 6,000 US dollars. FRCS and FRCOP, they are also considered as a acceptable medical qualification for GMC registration. If you are planning to settle to UK later on in life, then you have to do FRCS and FRCOP, because these are the qualified qualifications that are required, and your post-graduation examination certificate will not be acceptable. And you are also exempted from appearing for the PLAB, which is required for GMC registration. You get a better remuneration if you're planning to settle to Middle East, and FRCS holders, they get a new remuneration up to the order of 5 to 10 times more than those who are not. Other benefits will be the Department of Personnel and Training, Government of India also provide incentives for achieving those higher educational qualifications up to the order of 30 to 40,000. And then some people would like to give examination because of the joy of using the post-nominals. That is sometimes often required in the private practice also. You want to display the post-nominals to gather the patient crowd. And then there are some who would like to give exams because of the joy of clearing those. Mind you, there is a long roadway. There are multiple steps in these examinations, and if you are sure you want to appear, then you have to appear for all the steps. There is no benefit of appearing and leaving it in the midway. There is a prolonged interval between these examinations, and there are limited centers and limited seats, so it may take few years, 2 to 3 years, to complete the whole fellowship examination. The prices are also high. For the ICU examination, it may take up to 1.5 lakhs to clear all the examination if you clear them consecutively without failing in any of the steps. And for the FRCS examination, your Part 3 examination itself is costing you 1.5 lakhs. And FRCOP fees is even higher. In the Part 3 examination itself is costing you 1,94,000 if you are planning to appear this year. And the prices keep on increasing every year. There is a joining fees and annual subscription fees also. If you join these colleges, to avail their benefits, you have to renew your subscription every year. It's a tough assessment. At certain exams, you can have pass percentage as low as 33, especially the refraction exam or the FRCOP, and it's Part 2 oral examination. These fellowships are no way a license to practice abroad. These are only a standard of your knowledge. These will not be equivalent to your licentiate exam, and these do not guarantee especially a job in United Kingdom if you are planning to go there. Now, how to decode the dilemma? You should assess your needs first. If you are planning to start your private practice here, there's no point of giving the examination unless you want a post-nominal acronym to gather the crowd. If you're planning to be in a government institution, in an academic institution, then you should go ahead, because you'll keep on learning new things with these examinations, and you'll improve your clinical knowledge and skills. If you have decided to give these examinations, then you plan these examinations in length, plan all the steps in the future, dedicate appropriate time and effort, because you'll definitely fail if you do not study for these exams at least for a few weeks before the examination. You need to brush up your knowledge. The ideal time to appear for the basic sciences examinations will be the second year or third year of your junior residency, and then the clinical and advanced examinations, the ideal time will be your senior residency. Choose a country logically. Where do you want to appear for the exams? Your domicile you want to appear, or you want to appear in foreign, but then there is a cost of travel and cost of examinations also. Now choose between the ICU, FRCS and FRCS, which one you want to give. If you want to settle in the Middle East, then you give the FRCS exams. If you want to settle in United Kingdom, give the FRCOP exam. If you want to settle in India only and you just want to use a post-nominal acronym, then an FICO is enough, and you can also apply for fellowships later if you have a FICO degree. So even if your dilemma is not settled, then you should go ahead with the examination, because you should keep learning. And always, if you stop learning, then you'll not be a successful person. You'll be a successful person only when you keep on learning. Thank you.
Thank you, Dr. Deves.
Thank you.
And Dr. Tanai want to say something, comment something.
I have done my ICU fellowship.
Okay, right. We have one speaker, Dr. Pratik.
Thank you.
And please go ahead.
So I had done my ICU fellowship from Wilmer Eye Institute under Johns Hopkins University. It's not just the acronym that we are using, but also like we get a different perspective, different exposure, like how meticulously they do their way of doing things and seeing the patients. It was a very good learning experience. If given the opportunity, I think you also try. Thank you.
Dr. Pratik Nishan did his MBBS with honors and gold medal from Patna Medical College and MD ophthalmology from AIMS Rishikesh. He is qualified for DNB, has qualified for DNB examination also, and is currently working as a senior resident in AIMS Patna. His interest includes dash, 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 food, etc., photography. So over to you.
Thank you, esteemed chair and my dear friends. Thank you for the opportunity to put forth my views on a topic that is very close to my heart, balancing your aspirations as a clinician, surgeon, researcher, and innovator. What are the aspirations of this generation, the Gen Y and the Gen Z that we are dealing with? It is, say, work-life balance, quality of life, climbing the ladder, your clinics and your surgery, research and innovations, and entrepreneurship, financial stability, creativity in everyday tasks, and the list goes on. And the budding postgraduate resident or the early career ophthalmologist is perplexed with the question of how to move ahead. Of course, we have been told by our senior teachers that there is no elevator to success, you have to take the stairs. What we haven't been made to realize is that the first step must be taken in faith. And you don't have to see the whole staircase, just take the first step. That said, it is time for introspection. Can I call myself a terrific surgeon when I do sometimes create complications I myself cannot manage? Am I an astute clinician when I occasionally miss findings which are most critical for outcome? Can I be considered a prolific researcher when I have fewer than 10 publications in indexed peer-reviewed journals with high impact factor? Could I ever be a great innovator when I have no dream patents or textbook methods in my name? What I realized early in my postgraduate residency is that deficiencies or mistakes have the power to turn you into something better than you were before. And well, the journey has already begun. In post-graduation, we long for surgeries, leave alone surgical competence. Let me tell you, my friends, that there is no dearth of learning resources. We have to aspire to learn every aspect, including, say, the drum organization or the trolley setting or the OT sterilization. We have to learn from online videos, machine demonstrations, say in conferences or when someone comes to demo a new machine in your department, and simulations. You have to identify your mentors to encourage you, help you navigate and avoid pitfalls. You should never hesitate to scrub in with your seniors to assist and look through the side scope. Assist as you would like to be assisted. Try out methods under supervision to see what works in your hands. And most importantly, learn from complications others create and manage. I'd like to highlight what tools I have used in my career till now and what I intend to continue using for the benefit of the postgraduates here. One of them is YouTube, and these are my favorite YouTubers, our prolific professors and teachers who have been teaching us remotely. One of them, Dr. Nato Rosatelli, who is a prolific surgeon, uploads his videos in 3D, and that can be viewed on a 3D VR headset. So that is something I would like to convey. And of course, the champion cataractcoach.com, Dr. Uday Devgan. Online surgical resources also include those available through the American Academy of Ophthalmology One Network and the iTube, which is kind of the YouTube of ophthalmology. The dry labs and the wet labs are important learning tools for every postgraduate. This is a Kitaro kit, no financial interest, which is available for the learning of postgraduates in dry labs. You also have the model eye on which the demo phacoemulsification can be practiced. And these and several other methods are mentioned in this publication, which can be viewed by everyone. And especially this is not for individuals, but institutions to take it up and establish facilities for the postgraduates or the residents to move ahead. You also have some simulators or apps. The Help Me See simulator, which is currently available for the small incision cataract surgery. The people have a stall on the top floor, which our postgraduates can visit. The IC simulator, which is there for phacoemulsification and VR surgery. This is there in the AIMS New Delhi. And any postgraduate can use this simulation also. You also have some innovative apps on the iPhone and iPad that you can do to, to get an idea how the capsular access behaves. And these kinds of things are free, they're accessible to everyone. And these are things that you can use in your journey. In your journey towards clinical competence, try to treat all patients with the same care you'd give to your family or expect yourself. Build up a reservoir of trust so that your patients feel comfortable with you. Stay abreast of current technology and evidence-based patient care. Be strategic with time. Communicate effectively. Continue self-monitoring and self-evaluation. Diversify your skill sets steadily. Work up, investigate, manage, or appropriately refer, but don't forget to follow up. For the clinical skills, you also have YouTube resources, Morancore, iFocus, Best of LVPA Grand Rounds, Eklavya, Shankar Netrale. These are from standard institutions that not everyone has the privilege to attend, but they can always view these videos. You also have the University of Iowa Healthcare website, and of course, your clinical books. Improving in research, the 4P, which stands for podium power and peer-reviewed publications. Define the proportion of time to be allotted to each research. Honesty is paramount. Be realistic. Researchers are organized and enthusiastic about their career. Work closely, respecting your colleagues, fellow residents, and students. And seek some amount of support from your institution regarding productivity, your biostatistician, and to allow some productive research time. You can improve in research by staying committed to whatever new project and stick to the Gantt chart, because this every new publication is a long process. Well-written reviews and book chapters go a long way in increasing your credibility as a researcher. You may eventually be considered to be a reviewer for major journals, and subsequently you may get journal awards, citations, and recognitions among your peers. What I recommend for all residents is to sign up to this website, which is known as ResearchGate. This is my profile on ResearchGate, and you are free to follow all the prolific professors and the researchers in India and abroad, that you can look at their qualifications and their metrics and stay inspired. About gaining the innovator's spark, it is not always expected of an early career ophthalmologist, but hey, why not? Active involvement with one's national organizations, attending surgical meetings, and interactions with your peers often provides you interesting clues. You can seek answers to questions commonly encountered in your OPD, OT field, and the community. You can get ideas to do things differently and also to do different things. You seek opportunities to submit original innovations in national and international platforms. You have to know about the rules and methods for intellectual property rights. So this is an example of how to do things differently. This is a paper which came up in our paper in this month's issue of IGO. We have used a specular microscope to look at the meibomian gland configuration of the patients presenting with primary meibomian gland disease. This is one example of how we do different things. This is my postgraduate thesis, where I devised an innovative method to measure change in ocular cycloposition with strabismus surgery using a DSLR camera. So this was presented in AIOC 2021 and World Society of Pediatric Ophthalmology and Strabismus conferences. Friends, your career is a balancing act. It requires some more introspection and self-awareness. You have to make deliberate decisions, realize the power to change course at any time. And achieving this balance also requires choosing the right career path with focus on what is important to us at any given time. To strike the correct balance, plan each morning, reflect on the gains each evening. If your goals are smart, then it's perfect. If not, do make a short-term and a long-term to-do list in your mobile phone. Take frequent opportunities to assess progress, as well as developing smaller, more achievable interim goals. Honest self-assessment of weaknesses and areas that require remedial, and make a genuine effort to correct deficits where possible, and if not, redirect effort towards the area of strength. Keep in mind this matrix and work hard on self-improvement every day. Friends, do not burn out. Ophthalmologists fare relatively well in surveys of physician burnout, but hey, the figure is 43.4%.
Pratik, last minute, please.
Yeah.
Prioritize. Sharpen your skills with the resources available to you. Make a reward system. Make a support system. In conclusion, there are 3 words that I want to convey: your ability, your motivation, and your attitude, which comes through well thought out goals, reliable support structure, realistic and clear expectations, and frequent re-evaluation.
Thank you, Dr. Pratik. Since we have no more time for discussion, we'll just request.
Dr. Nagendra wanted to say something, and before that, all the chairperson and speaker will stand up here to take a group photograph. Yeah. Dr. Nagendra,
Yeah, all the speakers spoke very well and brilliantly, and they have did perfect justice to the topics and all. I just want to say that after the completion of PG and how to proceed in future. You have to have a clear goal in your mind where you want to go, like if you are going to have an institution or into the private practice. If you are going to the private practice, go to some training part kind of things in corporate or some medical institutions and start learning the skills and all to have a confidence. And then you come to the private practice. In between, you can save some money. Financial issues are always there when you start your practice. Then save money and invest and go solo. And later on, you go like developing an institution like everybody does. Then initially, everybody goes solo. Then they include the people, expertise, improve the expertise, and then going with a big name and all. So you have to have a clear goal. So very good, Dr. Nishant, and all that.
Thank you all.
Yeah, thank you so much. And we'll take a group photo.
Thank you all. Thank you very much for attending this session.